More people die from heart attacks between Christmas Day and New Year's Day than any other time of the year.
That's why the American Heart Association is urging people to be aware of the risks for deadly holiday heart attacks. Today, Dr. Tadea Diaz-Balderrama, a cardiologist with SSM Health, joins us to talk about this phenomenon. Thank you so much for being here.
Thank you for having me.
So to start off, what triggers heart attacks around the holidays?
So we don't know for sure. The paper really identified multiple theories, but we didn't know for sure within the paper. They thought that cold could play a role, but there was really no supporting evidence to say that cold significantly played a role. Increased risk of respiratory illnesses, which are associated with increased cardiovascular disease, increased stress, indulging in richer foods and unhealthier patterns. But really, I think the one that stood out the most is really a delay in seeking care that really kind of shined among all the other risk factors for that increased risk in deaths during the winter months.
And this is always important to talk about. What are the signs of a heart attack, and are they different for men and women?
Correct. So the signs of a heart attack, the typical ones that people associate are chest pain or chest tightness, shortness of breath, discomfort that may spread to the shoulders, the arm, the neck, the back, or the jaw, cold sweats, feeling fatigued, or heartburn. And there are significant differences between men and women in how they present. Women tend to present more atypically, so it's symptoms that are not, what you would expect from a heart attack. So it's important to keep a high index of suspicion with having symptoms.
What can people do to lower their risk of having a heart attack, not just this time of year, but year round?
Correct. Well, it's important to understand your risk factors. It's important to develop a good relationship with your primary care provider. Make sure you're staying up to date on your required health maintenance. Make sure you're identifying those risk factors and working as best you can with your primary to reduce them. Or if you already have established cardiovascular disease, making sure that you're managing them optimally.
Really good reminders. Now, if someone you're with could be having a heart attack, what should you do?
So most important of all is to get help, and really dialing 911 is very, very important. We have too many people that are showing up to the hospital with heart attacks driving by private vehicle. And the reality is the sooner you receive care, the better the chances are of survival. It's also very, very important for at least one person in the family to know CPR. Unfortunately, these events can sometimes lead to arrest, cardiopulmonary arrest, out of hospital arrests, and it's critical that we deliver CPR, high quality, hands only CPR, to make sure they increase the chances of survival in those patients.
All right, Dr. Balderrama, really important information. Thank you so much for being here and sharing that with our audience.